Moshi Moshi. Let's talk about the future. I'm Kristy Bird MaKieve, the CEO of Evergood Podcast, where we talk about all things healthcare, education, innovation. I'm very excited today to have a guest who I've been working very closely with, and it's just a really beautiful vision for transforming an entire region through medical education. So today we have Grant Hartzog, who is faculty with UC Santa Cruz in the heart of the Central Coast. And Grant is also the regional director of a new PRIME, which is a medical education acronym, PRIME Central Coast program. So we're going to go into the background of how we got to today, which is November 24th, 2025, and what the vision is for the future. So thank you so much for joining us, Grant. I know you're super busy with all that you do, but talking about this is just pure fun for me. So thank you for joining. So,
Thanks, Kristy.
yeah, you also have a lot of other titles. Yeah, so why don't you give us a rundown of all that you do? Just
Sure. So I'm a faculty member in the Molecular Cell and Developmental Biology Department here at UC Santa Cruz. I've been here since 1998. I have held many roles at the university over the years. I've been a department chair, I've been an associate dean. I am currently the faculty director for the CalTeach program, which aims to increase the number of highly qualified math and science teachers in K through 12. I'm one of the directors of our global and community health program here, which is a interdisciplinary set of majors shared between faculty in the social sciences and natural sciences that aims to broadly serve students with any interest in health or healthcare, from the health of communities and nations down to the health of individuals. Several years ago, I helped start our pre-medical post-baccalaureate program, which is on the Central Coast in Marina. And then more recently, I've become involved in the Prime Central Coast program that we'll talk about today.
so a lot of it is reaching to youth in the region to
Mhm.
pursue healthcare and
Yeah.
math and science, and to then build the programs to really strengthen that medical education pathway in the Central Coast.
Yeah.
Um, so I would love to hear your thoughts on how this big vision of building a medical school with UC Santa Cruz came to be. And I know it's a long year, a long time coming.
Mhm.
And then it sort of went really super quickly in the last year. So I'd love to hear your thoughts on that.
So I think two threads came together. The first is for over 20 years, we've had majors on our campus that serve the needs of students who are interested in healthcare careers. Um, Previously, we had a major called human biology that was started by several of my colleagues. And now that's called a Global and Community Health Bachelor of Sciences degree. That program includes an internship where we place students with healthcare providers or healthcare organizations in the region. And we try to be sensitive to the student's interests and needs. So if a student wants to go to vet school, we'll find them a veterinarian or a dentist, and so on. But probably half the students are interested in going to medical school, so we're looking for placements with local medical providers. The founding director of that internship, Carolyn Berger, set up a wonderful system. She became involved with the Santa Cruz Medical Association, became a member of the foundation board there. And a number of years ago, when she retired, I was asked to take her place on the foundation board. And so I became more entwined with the internship program and with the local medical community at that time. It's been clear to me for a long time that Santa Cruz is a medical education uh, part, or the Central Coast, I should say, is a medical education desert. There's really no medical school on the coast of California between UCSF and Irvine. There are very few medical residencies in the region, and given the cost of living and that lack of training opportunities on the Central Coast, we've got a continuing shortage of providers, both of physicians and of all other medical providers as well, I should add. So I've always been interested in trying to address that and help with that. So that's one thread. And then the other thread is our current chancellor, Cindy LaRive, was previously provost at UC Riverside during the years where their medical school was finally becoming fully independent of UCLA, who'd helped them start the program. So several years ago, after we'd started the postbac program, Chancellor LaRive came to me and said she was interested in exploring medical education options on the Central Coast through the sponsorship of UC Santa Cruz, and asked if I would help. So that was kind of the beginning. And then you're right, things went really quickly after that.
It's very wonderful to talk about the Central Coast too, in that there's some legislators who are big fans of this idea and are working very hard to bring things to fruition. So it really does take that village, that region, and
Mm-hmm.
everyone on
Yeah,
board to see the vision and start making those steps to bring it to
yeah,
fruition. We were just before the call counting out that there are 10 University of California campuses, and six of them have medical schools. And um, to note that UC Merced, which is a very new UC in the whole system, I think the newest in the whole system,
that's right.
is also launching a medical school under the wings of UCSF.
That's right.
And so it could be in a few years' time that there will only be two UC campuses without a medical school. That'd be pretty cool.
Yeah,
Yeah.
yeah.
But
Um,
might take a few more than a few years.
yeah. Yeah, it's a long haul to be sure, and I think we'll get into it. But the strategy we're taking here is to start small but fast, and then with the help of UC Davis, and then grow to independence over 1 to 2 decades, most likely.
Yeah.
Yeah,
So let's talk about Prime Central Coast. And I want to make sure that upfront we're clear that we're still looking for today FQHCs and hospitals to take current UC Davis medical students as they then build out toward taking the Prime Central Coast, making that branch campus really come to fruition. So let's talk about what all that means and um, what is Prime Central Coast?
sure. So after that conversation with the chancellor that I mentioned, which happened a year and a half or 2 years ago, we started to uh, shop around with that idea to speak to local medical leaders who I think at the time were sort of cautiously supportive when we were working with relatively unformed ideas. We spoke to UCSF. They were interested in being supportive, but they said, we've got our hands full with the project with UC Merced right now, so give us some time. And then, really, through that connection with the Medical Association, I had a chat one day with Dr. Donaldo Hernandez, who's a past president of the Medical Association, but more importantly, he's the past president of the California Medical Association and has broad connections throughout the state and the nation because of that. He had been at a recent conference where he'd bumped into one of the, let's see, I'm going to get the title wrong, I think Weistein's
Christine.
at the UC Davis School of Medicine, Dr. Mark Service. and they had started talking, and Dr. Hernandez suggested that we go up and speak to Dr. Service and his colleagues in Davis. So we went on up, and I would say, honestly, in the first 10 minutes of that conversation, it was clear that we were completely in sync, that we held common values, that we both saw a real duty to help produce more physicians for California, to train Californians in California to serve the underserved regions of the state. That then led to another conversation up at the UC Davis Medical Center with Chancellor LaRive. And then we were off to the races and pretty aggressively supporting this. And then you mentioned support from state legislators, and John Laird, state senator from the region, played a critical early role and helped us get $1.5 million from the state, which will let us launch the program. And then other legislators are also being very supportive. And I'd call out specifically Don Addis, Assembly member for this Central Coast, who's been an enthusiastic supporter of us as well. So you mentioned, it takes a village, and that's exactly right. We've got a lot of stakeholders here who recognize this need and who are enthusiastically pitching in. And even though it's a very uncertain time that we're living in right now, but people are being very supportive of us and positive. And we're going to launch very soon. We'll have the first medical students starting in July of 2027. And I think we'll go through it in more detail, but we'll have third-year medical students on the Central Coast in July of 2029.
Yes, it seems like it's a little bit far away, but it really is going to happen in the blink of an eye. And there, it's one thing to say we're going to have 6 medical students and in this branch campus in the Central Coast. But there is a lot of work that's already underway to make that happen, right? We're trying to bring the current rural prime students from UC Davis in more into the region. Our hope is that every hospital, right, and clinic is going to be involved and sharing that load. We're going to be building a faculty development series, at least for the next year, to make sure that folks are comfortable teaching medical students. And then also looking at ways to expand graduate medical education as much as possible in the region as well. So it's starting with the current students, I think, is that reason for us to be working really hard on it
Yeah,
now, even though it's still a few years away for the prime Central Coast students to be in the
yeah.
Central Coast.
Yeah, one of the important reasons to bring current students down, of course, is to make sure they're well connected with the region and start serving those workforce needs right away. The other reason is to help establish the relationships that we need with the clinical providers and preceptors to identify any pain points or problems that we need to solve as we start to bring the prime students down in a couple of years from now. If we step back for a moment,
Yeah.
PRIME is an acronym for Program in Medical Education. This is a program that was started by the UC system around 20 years ago. Every UC medical school has at least one PRIME program. These can be thought of as sort of a medical school within a medical school. So students in that medical school who are in the PRIME program get several hundred hours of extra education, focusing on the needs of some particular underserved community. UC Davis leads the way in the PRIME programs for sure. PRIME Central Coast will be the 5th PRIME program that they support. So they already have rural prime, tribal-focused prime program that they're starting now, a program that's focused in the Central Valley, and so on. fully a quarter of their medical school class is in one or more of their prime programs. So a moment ago, I talked about how they shared our values, and that's a really graphic illustration of that. They're a very progressive medical school. They say their motto is that we aim to produce the physicians that California needs, right? They're really aimed directly at those workforce needs for Californians' physicians workforce.
So the applications for Prime Central Coast open through UC Davis on May 26th of
Mm-hmm.
2026. So about
Mm-hmm.
6 months from now.
Yeah,
Very, very exciting. And can you describe a little bit more in terms of what the selection committee will be looking for in those applications?
sure. So we're looking for people who have lived experience on the Central Coast. We want people who are familiar with the region, familiar with the needs of the region. We think that it's that familiarity and their family ties that are going to bring them back here to practice medicine someday. It's no secret that it's an expensive place to live here. Local provider organizations have a tough time holding on to their providers because people can move 30 miles away to Silicon Valley and make more money. So we want people who have, those emotional ties to the region. All things being equal, we would prefer people who can speak Spanish as well, because a huge fraction of the population is Spanish speaking. And if we could find, strong applicants who speak indigenous languages, that would be a home run. If we could find strong applicants who speak Mixteco or Triqui, for example, there's a huge need for providers who can communicate with patients who only speak those languages as well.
And, some programs really focus on, going into primary care, and that is a part of this. But I think as more graduate medical education programs develop in the region, it is any specialty. It was really exciting at the gala on the 14th to hear from the one current medical student from UC Davis who wants to pursue psychiatry, and
Yeah,
I'm all about the psychiatry residency forming in the region. So
yeah,
that was just the coolest moment for me.
yeah.
Yeah.
So, right. I mean, there's a desperate need for psychiatrists on the Central Coast, just like every other region of California. So we would definitely be interested in students who are interested in behavioral health. We would be interested in supporting, through the Medical Association now, the formation of new GME programs focused on primary care, on psychiatry, and so on. California doesn't train enough medical students. California doesn't have enough residency slots. So it's really an all hands on deck moment for us that we need to increase the number of medical students we train, and then we need residencies for them to go to. And we want to place those residencies in places where the greatest needs are. And you had experience with that up in Chico, and we'd love to replicate that experience down here as well.
Wonderful. Yeah,
Yeah.
I'm excited. So we're going to start with 6 students being
Mhm.
accepted into Prime Central Coast this first year, um, and then over the next decade expand to 16. So
Yes.
yeah,
Yeah. So the goal is to, as we gain experience, to expand, and that experience is partly on the side of UC Santa Cruz with the help of UC Davis now building up the administrative capacity to run the program here locally. And we'll talk a little bit more about what that program is going to look like. But then also, as you mentioned, to build up the professional development for the physician preceptors so they understand how to efficiently precept the students so they can still see the patients they need to see, how to appropriately evaluate the patients, how to maintain the LCME accreditation that's coming from UC Davis as well. And that just gives us time, to that with that slow growth of sort of identifying things that we need to work on. However, the long-term goal is to form a fully independent medical school on the Central Coast. And that'll certainly take more than a decade, and I can't tell you exactly where it'll be, but we want to have a medical school that serves the needs of the region, because it's pretty clear that nobody's going to come to our rescue otherwise.
Yes, I think that we're coming into a sort of a physician scramble across the United States where there's going to be a shortage everywhere, and the areas where you're not actually growing your own is the expression that we often use, that you're going to be in even worse situations in the future. So yes, and I think the UCs in general are very supportive of growing, adding more medical schools, medical programs, being innovative in this space. So like what UC Davis is doing with the Prime Central Coast and a potential branch campus. Can you describe uh, what we need to be doing with Prime Central Coast to ensure that it is a branch campus? There's the whole regional campus, there's the branch campus, but I think for this podcast and for the folks locally in the Central Coast to hear it is really that commitment to this, and so can you just describe what you envision for that?
So, as defined by the LCME, the accrediting body for medical schools in the United States, a branch campus requires the full suite of third-year clinical clerkships. At UC Davis, those clerkships are family medicine, internal medicine, pediatrics, OBGYN, psychiatry, and surgery. And then third year medical students at UC Davis get a seventh elective clerkship. So to become officially designated as a branch campus, we need to build out those clerkships here. There's some other requirements in terms of providing adequate housing options for students and healthcare for students, access to a library and things like that. And at that point, once we've achieved all of that, then we get that official designation. Uh, Once we've done that, then we'll start building out fourth year clerkships as well, identifying sites for electives and sub internships, and so on. The students will do their first 2 years at the UC Davis Medical Center, which is in downtown Sacramento. But across those first 2 years, they'll be making periodic visits down to the Central Coast for continuity clinics. So 5 weeks total in the first 2 years will be spent on the Central Coast. We'll help house the students when they're making those visits down here. And then we'd very much like them to continue on working in those same clinics once they've made the full-time move down to the Central Coast in their third year.
Thank you for that. Yeah, it just because not everybody understands that and knows that, so, and we're looking for as many partners as we can, right, to make this possible quickly. I feel confident after the work that you and I have done since just August, that out of the gate this will be a branch campus.
Oh, yeah.
Yeah.
So for the listeners, Kristy, you and I have put several thousand miles on our cars in the last few months. We've visited almost every significant healthcare facility between Santa Cruz and King City. We are talking to those providers about signing affiliation agreements with the UC Davis School of Medicine. that will allow us to send medical students to them. We're answering their questions about what the expectations are and needs are. And because we're starting small, at this point, our asks are not big. If I were to go to them and say 2 years from now, I need 50 slots for third year medical students, I think people would have a heart attack.
Pretty much.
But we need 6 slots a year to begin with, and then we'll build it slowly over time. So we recognize there's a bit of a culture shift involved here and a capacity building project here. And because we want to start quickly and get going as soon as we can, we're starting small, and then that'll allow us to build over time. That the other model would be to go out and spend 10 years hiring consultants and building buildings and raising money and then starting to bring students here. But that doesn't serve our needs right away.
Yep, exactly. The situation is now, right? Need to get that going. And it's not exclusive. We're not asking the clinics and hospitals that are already taking medical students from elsewhere need to shut that down and just do UC Davis. I think this slow growth approach um, is allowing those facilities to honor their commitments that they've already made. And like especially with Toro University, they have quite a number of students already in the region. And so honoring those commitments is also our goal. And
We're,
yeah,
yeah, we're looking for cooperation, not competition
yeah.
here. Absolutely.
So we're going to have a kickoff, the official kickoff on December 4th. So that's next week. How did that happen? Uh,
Uh, how did that happen? That was discussions, I think, mainly with the chancellor to begin with, saying that we should have some official announcement, bring people together. We'll have a delegation from the UC Davis School of Medicine coming down, faculty leadership, current medical students from UC Davis who grew up on the Central Coast. So we actually know those qualified medical school applicants exist here. Students from our post-bac program are invited as well. Many local physicians, also local politicians or their staffers will be there as well. So it's an opportunity for us to officially unveil the program, to explain the program to local physicians whom we might not have met with yet, and to help generate some excitement over the program.
yeah. Another thing, just to make sure we mention, in case anybody from the Central Coast is listening to this and wanting to be involved, I think there is a commitment from UC Santa Cruz to help with coordination, especially since we're looking at the LIC model. I don't know if you want to get into the LIC model now, but um, there is a significant amount of coordination, and then we also want to be supportive of those students. We're not just looking to send them into the Central Coast, far away from the main medical school, and let them go out there on their own, right? We're looking to be as supportive as possible, and it's a wonderful thing that UC Santa Cruz is fully on board with that.
Yeah. So starting with 6 allows us to have a bit of a cohort. So, kind of mutual support from the medical students themselves. We'll try and house them together in a centrally located area where they can go in any direction they need to be in a reasonable amount of time. We're very aware of the car travel challenges here. We're keeping that
I
in mind.
learned all about those.
Yeah. um, we uh, were, as you mentioned, want to use what's called the longitudinal integrated clerkship model, LIC model. So this is a model of clinical medical education that's being used in a number of places now. And the idea is that you put the students into outpatient clerkships that last throughout the year. So I talked before about how UC Davis has the 6 core clerkships. So, for example, pediatrics, when you do your pediatrics clerkship, you're going to need to spend some time inpatient in an inpatient setting, seeing kids who are admitted to the hospital or in the NICU and so on. But a lot of that time is spent outpatient. So, of that 6 week block, we'll put them 2 weeks in the inpatient setting, but then throughout the year, they're going to be spending uh, significant amounts of time in a pediatrics rotation. Likewise, in the next 6 week block, it might be OBGYN. So they might spend 2 or 4 weeks working on a labor and delivery service in a hospital. But then in the other weeks, they'll be in their outpatient clinics and so on and so on. The outpatient clinics, in their outpatient weeks, Monday might be pediatrics, Tuesday morning might be psychiatry, Tuesday afternoon might be outpatient OB, Fridays might be devoted to surgery, and so on. So they're in those clinics, over significant amounts of time over the entire year. And the data says that people come out of there with clinical skills that are as good or as better than medical students trained under the traditional block model. They're more likely to go into primary care. And so we're going to give it a shot. It creates some flexibility on the part of the medical providers, the preceptors, because you can shift those inpatient weeks around pretty easily. It creates an administrative burden on the university for sure, but we will be mentored by administrators at UC Davis, and we have money in our budget that allows us to hire an administrator full-time on the Santa Cruz campus to handle all the scheduling that goes along with the LIC model.
Right. So again, if a physician or provider at a clinic or hospital on the Central Coast is listening to this, again, we're here to reassure everybody that this is going to take a village, and we're all, dedicated to making sure that it's not too much of a burden on any one physician,
Right.
really.
Right. Yeah.
So I think it's a really great plan, and the fact is that we're already building the ship, and it feels like it's off to a really awesome start. Yeah.
Yeah, we're super excited about it. You know, and it just wouldn't have happened if we weren't surrounded by many, many like-minded, community-spirited people within the university, within the local medical community, our state legislators, our local legislators. Everybody's headed in the same direction right now. It's pretty awesome.
Yeah, we met a lot of people since August, and everybody's just enthusiastic and wants to be thoughtful, but also wants to be involved. So it was really great to meet everybody
Yeah,
and see that. Is there anything else that you wanted to share?
sure. So, I mentioned our pre-med post-bac program,
Right.
and that started a little over a year ago. And that shares many of the same values that we described for Prime Central Coast. So we're trying to identify local kids who have college degrees, who need a little bit of help in putting together a successful application to medical school. And that may be they're missing a class or two, or they need to raise their GPA, they need help studying for the MCAT, they need mentorship, they need shadowing hours, they need help putting the application together, perhaps. So we just started with our second cohort of 13 students, many of whom are supported on scholarships. Back in September of this year, the first cohort are studying for the MCAT or applying to medical school now. We've gotten a tremendous level of support from Kaiser Permanente physicians and from the Minorities in Medicine program at the Community Hospital of Monterey Peninsula. Both of those outfits are providing significant shadowing hours and mentorship to our students. I also mentioned our Global and Community Health program and the internship program that has that's been going on for many years. And now, stepping even farther back, we're starting to go out to local community colleges and talk to students who are interested in healthcare careers, not only medicine, by the way, but any career in healthcare that might require a 4-year degree, and talk to them about how UC Santa Cruz can serve their needs. That's a particularly important point because the community colleges are more likely to have those local grown students that we're aiming to find for the Prime Central Coast program. Then UC Santa Cruz is also part of the regional, well, let's see, what do we call it now? The Central Coast Regional Collaborative,
Right.
K-16 Collaborative. And so this is a state-funded program that aims to help students from historically marginalized school districts get into careers that pay a family-sustaining wage. And on the Central Coast, one of our main goals is to focus on healthcare careers. So now we're reaching all the way down to middle school to identify students. So the only missing piece now is residencies and fellowships. And at that point, we will have really kind of built out an entire pipeline starting from middle schoolers going to physicians finishing their training.
Amazing. Yeah. It's so inspirational, I think, for any youth who can see that in their own backyard they could become a physician. I think that has so much merit and potential for the future. Really wonderful. Can you, there is another post-bac that's new in the Silicon Valley. Did you want to mention that or?
Yeah, so we started a parallel postbac program just this year in the Silicon Valley. And that, so the program on the Central Coast, which is in Marina at a UC property there, the Marina program's really aimed at people from the Central Coast who already have their college degree and have fulfilled most of their pre-med requirements. And then we provide the help that I just described. The program in the Silicon Valley is mainly aimed at career changers. So, you know, the software engineer who decides that she wants to go into medicine instead, for example. So that program has more of a focus on providing people with classes they need to fulfill the prerequisites for medical school, as well as all the other things that I described as well.
Right.
So that program's just getting going. It's quite popular. There are a lot of people out there that don't like the careers they're in and would like to go into medicine and be more people focused, public service focused. And so I think we've got 38 students in that
That's
program right now.
amazing.
Yeah,
The
so it's
first
quite big.
cohort, and
Yeah,
yeah.
yeah,
I've never, yeah, that's a new one for me that engineers might want to become doctors. But it, you know, very true, right? They go through that whole pathway, and the engineering degree is quite intensive, so they weren't taking maybe some pre-med courses and
right.
in their education journey. So, what a phenomenal idea!
Yeah,
Yeah.
yeah, yeah. We've already have a number of engineers, former engineers, I should say, in the Santa Cruz area who are physicians now, and we've recruited them to go speak to the Silicon Valley cohort of the postbac program as well as serve as role models.
I actually knew one in Chico who was engineering and then went in all the way to ophthalmology.
Yeah.
And if you think about it, the eyeball is pretty uh, pretty
Technical.
interesting.
Yeah, right, right.
It is a bit of engineering in there.
Yeah.
So, well, this is a great discussion. It's been about 45 minutes. So if there's anything else, or I want to be respectful of your time, and I know you have lots to get to. Anything else?
Um, no, I think that's it. Just to say, we want people to join us and to work with us to serve the needs of the Central Coast. And if there are people out there who are interested in mentoring medical students or learning more about what we do, please put them in contact with me, and I'd love to speak to them.
Yeah. There is also the fundraising. I think that we should be putting out there, even though the actual fundraising may not be fully defined. I think, UC Santa Cruz will be looking to build out scholarships to support these prime Central Coast students for
Yep.
sure. And then, we're looking at Physicians for a Healthy Central Coast and its medical association to fundraise as well, to support maybe more of these ancillary programs. But that we're still defining what that looks like.
Mhm.
But yeah, if there's commitments that people can give monetarily, it would be fantastic for ensuring the future growth. And then we'll be looking for those big dollars to launch that medical school in the next coming decades. So.
Yep. Yeah. That's a really critical point. Uh, I mentioned this for the postbac already, right? The people that we're really aiming to get into medical school are often people who come from families of limited means, for whom paying for medical school was daunting before President Trump's One Big Beautiful Bill. But now with the new loan limits that are coming in, that they could really put medical school out of reach for many of these people. So we're definitely going to look for ways to support them with scholarships to make medical education financially attainable for them.
Very well said. All right, Grant, thank you so much for joining Evergood Podcast today. And I am going to be in touch with you about all the other things we're working on. So,
Thanks a lot, Kristy. Good to see you.
good to see you too. Take care.
Lost my sense of humor, I found them too fun to know. Overcrowds, blow up kayaks, would have helped with angry toes, but it gave mashed potatoes. Take that meatloaf back, hi. Birthday dehydrated cake and box of wine so nice with clean dark hair. I think it's a waltz, I think it's a waltz, but I know it's the longest 2 miles of her. I think it's a waltz, I think it's a waltz, but I know